intellectual disability and scientific research, from diagnosis to treatment. Why and how do we search for the origin of intellectual disability? Intellectual disability, or mental handicap, is a neurodevelopmental disorder characterized by impaired cognitive function and adaptive behavior to complex or new situations. It affects language and logical reasoning over a continuum of severity, ranging from mild to severe. It can be diagnosed at different stages of development, at birth, in early childhood, or later, when the child starts struggling at school. Establishing an accurate diagnosis for the disease is one of the most important issues for patients and their families. A diagnosis makes it possible to understand the origin of disorder, the disease itself, and its progression, and adapt to medical follow-up and education. Families can also attend genetic counseling and learn about the possible risks of transmission. Intellectual disability has many potential causes, which explains the great heterogeneity in type and severity. These causes may be related to events that occur during brain development, including infection, intoxication, trauma, or lack of oxygen. Or they can be the result of a genetic abnormality that alters how the brain structures itself from the time the embryo is conceived. In as much as 50% of cases, we still do not know the underlying reasons for the intellectual disability. It is estimated that more than half of undiagnosed situations are due to unidentified genetic abnormalities. Scientific research makes it possible to discover new genes involved in intellectual disability every year. Reducing the diagnostic odyssey of patients is only possible through scientific progress and improved access to specialized consultations and examinations. From the moment the embryo is conceived, our body develops from a unique genetic program encoded by the genes contained in our chromosomes. Genes are composed of a succession of codes that allow the production of molecules necessary for the growth and proper functioning of the body. Variations in this code exist in all individuals. Most of them are harmless, but some severely disrupt the development and functioning of the brain and can lead to intellectual disability. High-throughput sequencing is a technology that allows the identification of genetic variations, the difficulty residing in analyzing and interpreting these large datasets to establish a link between the variations seen in a gene and the disease. The discovery of a genetic anomaly is an important step for families. Generally, it does not lead to major changes in existing support, but it does make it possible to adapt the support plan and to provide specific medical follow-up. This is the case for a number of syndromes that are now well described and for which there are specific care recommendations, providing a real improvement in patient health and quality of life. Each patient thus contributes to a better knowledge of the disease and its effects, and can help to advance medicine.